Good morning. This is David Lindeman, Director of the Center for Technology and Aging. I'd like to welcome you to the ADOPT Toolkit webinar. We're delighted today to bring you up-to-date information about the toolkit that has just been developed and released for helping individuals not only addressing remote patient monitoring programs, but helping address organizations implement a wide variety of new technologies. I would like to, before we get started, take everybody through just a brief housekeeping session so that we're able to move along quickly, and obviously want to make sure that people, if you do have any issues with today's session, you can reach us at the 866-229-3239 number for any technical difficulties. And audio, we hope you're all picking this up right through your computer. We put the note up that for those folks who may not be getting the audio, they can reach Val Steinmetz to help them pull their program up. I'd like to ask that as we move through the day that you anticipate responding and giving us input on our post-webinar survey, which will be put up right after the session ends. Today's session will be recorded, and the slides will be available in the near future on our website, www.techandaging.org. As we continue to move through the day, we'd like to request that all questions come through the chat function on your WebEx computer system so that we can handle those specific questions at the end of the program after our different panelists have had a chance to speak to the entire group. With that, I'd like to share that our agenda today will take us through several different approaches to looking at the ADOPT Toolkit. I will be giving a background and overview about the development of the program and how our different programs and organizations that have worked with us have contributed to the building of a wonderful tool that can now be used by a range of organizations in implementing not only remote patient monitoring, but other technology-enabled programs. We will turn then to actually how to use the ADOPT Toolkit, have information presented on several of the specific tools and how they are applied, and then hear from two of our colleagues who have contributed to the development of the toolkit and will speak to how they have used it in practice. So with that, I'd like to provide a brief introduction to our speakers. Again, I am David Lindeman, Director of the Center for Technology and Aging, and have been involved in long-term care and aging for over 30 years. I'm currently both Director for the Center for Technology and Aging as well as Co-Director for the Center for Innovation, Technology, and Public Health here at the Public Health Institute. I've worked on beneficial technologies, interdisciplinary care delivery, development of different innovative community-based and residential programs, as well as healthcare education and training over the last 30 years, and have been principal investigator on numerous federal, state, and privately funded studies. Previously, I was founder and director of Mather Lifeway's Institute on Aging, a national applied research center dedicated to improving healthcare delivery for older adults. I've also held positions as associate professor at Rush University Medical Center and co-director of the Northern California Alzheimer's Disease Center at the University of California, Davis. I'm pleased to be joined by my colleagues, Val Steinmetz, who is Program Director at the Center for Technology and Aging and has served as the lead director of our Remote Patient Monitoring Initiative, as well as the lead developer for the ADOPT Toolkit. Val has 8 years of experience in working with innovative healthcare solutions across the care continuum and previously worked at the Health Technology Center, where she was manager of research and product development and was responsible for coordinating research on both emerging technologies and conducting scans of health technology, of the health technology ecosystem, and work directly with hospitals and health systems to help them prepare for the implementation and adoption of healthcare technologies in their institutions. Again, Val has been our lead developer on the ADOPT Toolkit, and I think you will appreciate her expertise as she does take us through the specific tools. We're also joined by Alan Little. Alan is an industry consultant and senior advisor to the Center for Technology and Aging. He has held a variety of healthcare leadership positions for the last 15 years, including serving as vice president with the Regional Medicare Advantage HMO. He's led the investigation and implementation of a number of new technologies designed to enable greater independence for frail seniors. And he's introduced remote patient monitoring technologies into existing healthcare work processes. Alan has held senior leadership positions within the FIRST Consulting Group and held management positions within several global technology leaders. And his roles have included being responsible for business market development, strategy, operations, and technology-related services, both for domestic and international healthcare clients. Jason Broad represents one of the developers of the toolkit. He is the director of Lean Six Sigma for Sharp Healthcare in San Diego. Sharp Healthcare is an award-winning healthcare provider that's on the cutting edge of innovations in healthcare delivery. Sharp has won the prestigious Malcolm Baldrige National Quality Award and has been selected as a Plaintree designated patient-centered hospital. Jason is responsible there for implementing Six Sigma lean workout and change acceleration process at Sharp Healthcare, and it is dedicated to improving operational, financial, and clinical performance for their system. Jason has 15 years of experience in healthcare at hospitals around the country, working extensively in information technology, finance, and clinical effectiveness. And finally, but not least, Wendy Everett is president of NEHI in Boston, Massachusetts. NEHI is an independent research-based organization nationally recognized for its work in medical innovation, as well as patient safety, healthcare spending, healthcare information technology, and healthcare policy. Wendy is a pioneer and national healthcare leader and has dedicated her career to improving the quality and affordability of healthcare across the country. Wendy passionately supports innovative approaches to stem the rise in healthcare costs and inefficiencies of our healthcare system, and she has had broad healthcare experience over the last 40 years. This has included serving in executive positions at the University of California, San Francisco Medical Center and Brigham and Women's Hospital in Boston, directing national demonstration programs for the Robert Wood Johnson Foundation, the Kaiser Family Foundations, and serving as the director for the Institute of the Future. As we move ahead, I wanted to be sure you just had a context in terms of the Center for Technology and Aging. We are a not-for-profit organization who's dedicated to accelerating the diffusion of proven technologies. We are a national resource center for organizations who are looking at technology-enabled solutions to not only working with improving the independence of older adults, but also improving our nation's chronic disease management. We've conducted technology demonstration projects now with over 100 organizations throughout the U.S., and we are providing both professional services to organizations looking in the space and conducting research, evaluation, dissemination efforts, and are also contributing to public policy development in this space. The focus the Center has taken for the last few years that has led to the development of the ADOPT Toolkit has been looking at a number of promising technology solutions that cover a range of programs that help individuals in the home as well as help senior service providers. Our emphasis has been on remote patient monitoring, medication optimization, post-acute care transitions, and most recently, health solutions. And we are looking broadly at the other aspects of technology that can help improve healthcare across the entire healthcare system. The basis for the development of the ADOPT Toolkit came from our work in these 4 areas with an emphasis on how we can improve healthcare delivery and reduce costs of care. The specific efforts of 22 different organizations and grant programs helped develop both the identification of the need for an ADOPT Toolkit as well as contributed to our different tools that you will be seeing today. In this environment, we're currently have realized the importance of how technology can help different types of care delivery systems. We're currently facing an aging tsunami, not just with the number of boomers who are, this audience knows, currently moving into growing into the older adult environment, but also the number of individuals 85 and older and those who have both chronic disease and chronic complex conditions. The costs of care are increasing, with 70% now being attributed to chronic care conditions. We're also in the midst of shortages in the healthcare workforce, ranging from geriatricians to frontline workers, all of which contribute to the need for improved efficiencies and new care delivery mechanisms. In the era of dealing with the triple aims and how to respond to those, particularly with new penalties and issues around 30-day readmissions that have just been implemented, also looking within the spectrum of new healthcare delivery models and revenue programs, and dealing with new and much more intensive populations needing care, we have determined that a great deal of effort and benefit can come from these various technology-enabled programs. We have designed the ADOPT Toolkit so that it is able to not only help organizations quickly and effectively identify and determine what types of technologies and programs that can benefit their own healthcare system, but have been developed with the intent of providing very pragmatic hand-on examples. So in the development, as you will see, of the toolkit, we have included a number of guides, specific examples, and templates for use by different organizations. Before I pass the baton over to Val to discuss how to use the toolkit, I'd just like to make several acknowledgments. First, to all the different organizations that have contributed to the development of the toolkit, including our grantees and partners that range from community health centers to hospitals and health systems, large home health systems, county-operated medical centers, and government agencies such as the VA. And in addition, would be remiss if I did not acknowledge the excellent support from the SCAN Foundation, California Healthcare Foundation, Gordon and Betty Moore Foundation, and the Commonwealth Fund for their resources and support in developing various tools and ultimately the development of the toolkit. I'd like to now turn the program over to Val Steinmetz, who will take us through the specifics about the toolkit and how we can, how organizations can best use it. Val?
Thanks, David. It's very exciting to be able to share our toolkit and tools with all of you, and we really look forward to hearing what you think about the site and how you plan on using the tools in future projects. So to start off, I wanted to walk everyone through the toolkit website, discussing the structure of the toolkit, reviewing toolkit focus areas, our workstream framework and guides, and then how users can access and download tools from multiple points on the site, as well as really find the right tool for the right task. And then finally review how you can provide feedback on the tools and toolkit itself. So this is what our homepage looks like for the ADOPT Toolkit website. Hopefully you've had a chance to take a look around the site and register to access our tools. From the homepage, you can read about more information on how to use the toolkit site at the About ADOPT tab in the navigation panel. You can also find additional resources relating to the toolkits. You can access all 4 toolkits from this drop-down menu in the navigation tab, but also on the homepage itself. And then you can find more information about CTA itself and our advisory services. The structure of the website is you can log in and register for an account on the right-hand side column of all pages on the site. So the way we structured the toolkit, as David had mentioned, we have our 22 grantees across 4 grant cycles. And these grant cycles are divided into 4 technology focus areas, which correspond to our 4 main ADOPT toolkits. These toolkits are currently in various stages of development, where the Remote Patient Monitoring Toolkit is currently populated with tools and guides, and the other 3 areas, mHealth, medication optimization, and care transitions, are all in development. So within each toolkit, tools are organized into 8 work streams. These work streams correspond to the overarching program functional areas, and they provide a way to help users better understand and organize all of the different tasks involved in implementing technology programs. So one thing to note, work streams are not sequential. These often segue and overlap into one another during the course of program implementation. So we realized very quickly that one implementation timeline did not fit well with all of our programs. And we wanted to go with a framework that gave us flexibility to provide tools to a broader audience. And the rigidity of a timeline approach really would not work for all organizations. So using this workstream framework and dividing tasks into these 8 functional areas, this allows users or program staff to self-select work streams that they're most interested in. So for example, let's say you're a clinician, you may be more inclined to first look at tools within the clinical management and patient management work streams before looking at the other sections. Or if you're an evaluator for the program, you will take a look at the evaluation and performance improvement section, and then go on to look at program planning and some of the other areas. As well as if you're maybe program administrative staff, you'd start off looking at the administration work stream, financial management, and program planning. So going back to the website, all of our work streams are aligned in this manner. And to be able to access the tools, you're going to click on this more or less button right next to the title of the work stream. So this next slide shows what work streams look like it shows a specific program planning work stream. So we have an additional structural layer of subtasks. And then we also list the tools themselves right below it. So each of our work streams, it varies in the numbers of subtasks that they have, but it generally ranges from 2 to 4. So for this example, for program planning, we have the subtasks of program design and change management. Another important structural element to our toolkit are what we call guides. So guides on the website, they're located right before the work stream title. And these are detailed they're detailed guides that offer action steps and things to consider when implementing tasks of a technology program. So we recommend that all users download these guides first before reviewing the individual tools. And we have a couple different ways for people to access tools. The first is directly from this toolkit page, where you can either download the individual tool, and I've highlighted this telehealth organizational readiness assessment tool. You can either click on that download link on the right side, or you can click on the title of the tool to find out more information about the tool and then decide if you want to download it from there. We also have this feature where you can download all workstream tools into a zip file, and this requires that you have zip software. So I took a screenshot of what it would look like, and these are the 15 tools of the program planning workstream for remote patient monitoring. So this way you'd be able to have all 15 tools downloaded at once. It's important to note that the guides are not included in the zip file, so you do need to download those individually. So if you go back to tools for a minute, you can click on the title of a tool and you get more information about the description, the target audience, and then helpful tips in terms of how to use this tool. So these tips, these are recommendations based off of real-world experiences from our grantee programs, as well as other experts in the field. So make sure you take a look at these as you look at the tool itself. You can also leave feedback for us through this post-comment feature, and this relates to the specific tool itself. So if you have anything you want to say about the tool, any sort of questions, you can post it here, and you'd be able to review other comments from other users on this page as well. So we have another navigation function for users in terms of selecting tools as well. So we have the workstream framework that I just went through, but then we also have this starter kit. And for this starter kit, this is really a set of tools that we think would be useful for organizations that are new to technology adoption. So this starter kit, it suggests that organizations review these tools first, but it's not intended to be all inclusive of tools needed for a project. So our first toolkit that we have developed, and tools are currently available right now, is the RPM Toolkit. So a quick background on RPM, and we have more information on this in our position paper on remote patient monitoring. But RPM technologies, they can help manage and monitor health conditions of older adults. And when we refer to RPM technologies, we're including standalone or integrated home monitoring devices and peripherals that collect and send clinical and/or behavioral data to clinicians, which can be reviewed and analyzed to determine if any form of action or intervention is needed. So below this, I've listed the top 5 targeted health conditions that are being monitored right now. And this corresponds very well with what our grantee programs were looking at. And the majority did focus on heart failure. So when you take a look at the specific tools and examples in the toolkit, a lot of them will say if they're referring to programs that we're looking at or were used for heart failure patients, or a combination of heart failure, COPD, diabetes, or COPD alone. And then I think most of us are familiar with the benefits of remote patient monitoring. They're very well documented, but quickly, RPM has been shown to support patient self-management, reduce the use of emergency department and hospital services, and improve patient and provider satisfaction. So with that, I'll hand it back to David to introduce Alan, and then Alan will walk us through some RPM Toolkit applications.
Thank you very much, Val. At this time, we'd like Alan Little, who has served as a senior advisor and worked on the development of the toolkit with us, to walk people through several applications of some of the individual tools. Alan?
Thanks, David, and thanks, everyone, for joining the webinar today. So what I would like to do is to actually show you 4 of the tools within the starter kit and contemplate with you their application and how they might be used to address specific challenges in initiating a new program, or in some cases, optimizing an existing program. So we see on this first slide a woman contemplating how to get started. And there are a lot of moving parts to implementing a new program. For example, the role of technology. And we'll discuss later that technology is not the complete solution. It might be 10 to 25% of the whole model. Another thought is, do I have strong executive support? Do I have a champion within the organization that can help me tear down barriers and get things done? In terms of operational workflows, can I introduce technology into existing operational workflows, or do they need to be redesigned? And that's something that needs to be carefully studied and contemplated. All of this refers to, in some part, managing expectations across an organization and engaging folks to support the program through understanding and through engaging them in a way that gets them excited. Another thought there is acting on actionable data. So if we have clinical data that Val referred to and it's transmitted, it needs to be acted on, otherwise it doesn't do anyone any favors. Another thought is the ability to scale a program. It's one thing to introduce a program in a pilot mode in a small, with a small sample size, but it's quite another to grow it to hundreds of participants. Patient engagement is a concern, and this all refers to that kind of top bubble to the right there, planning and design of a program. So if we go to the next slide, you'll see the inventory within the starter kit again. And what I'll focus on, I'll give you examples of the readiness assessment, the making a case for RPM document, goes to the bottom of the page there, the planning budget model, and also the forthcoming ROI calculator. So one of the challenges that seems universal with implementing a new program is that organizations do not sufficiently understand program goals, clinical focus, and operational capacity. And that might be expressed in the question, are we prepared, or how prepared are we to implement an RPM program, and what does success look like? So if we went to the toolkit and the starter kit, we'd see that there's this tool called the Telehealth Organizational Readiness Assessment. And I want to show you what it looks like. And I'm just going to give you a screenshot. It's much more in-depth than what you see here. It has sections including the organizational awareness and leadership section, organizational planning and preparedness, and organizational technical preparedness. So it has a set of questions for each of those sections that results in a rolled up expression of how ready you are relative to other organizations that have done this type of work. One of the strengths of this tool is if you have a low score on a certain element in any section, is it helps you focus on those areas that need attention before you can really advance the program. So we think this is a great place to start, and I wanted to show it to you as the first of the many tools within the starter kit. Next, I'm going to go to another challenge, which is organizations often struggle with how to promote the program and engage all operational and management levels. And that refers back to my comment in part of how to engage senior leadership and find strong leadership support and clinical support and educating an organization, bringing it along the educational curve so that they understand the strengths of RPM and what the goals might be collectively. So the tool that I'm going to show you is this making a case for RPM presentation. It has many components in it. It speaks to cost trends, to existing results and evidence, types of interventions, who should be involved. I'm just showing you one of the many slides here that conceptually shows that the arrow moving from right to left is the effort to reduce costs, and to merge with that arrow on the far left, which is quality of life. And it shows the many stages improving in improving the quality of life. And this, again, is a conceptual wrap-up within this presentation that might be useful. Okay. Then another challenge is organizations often struggle to fully anticipate program goals, or program costs, excuse me. So program costs are not a one-time effort. There's a first year and then recurring costs. And so what are all the elements that it takes to initiate a program in year one, and then what do I budget moving forward? So the tool I want to refer to here is the Remote Patient Monitoring Program Model Budget. And again, here's just a little screenshot that shows an expression of what the tool looks like. This is only the service cost section. In addition to that, there's software costs, there's a hardware cost section, there's a data conversion cost section, there's a training section, there's a systems interface section. And there are so many elements that this is an excellent inventory for you to help anticipate where all the costs are and do some early planning that's accurate. So I'm going to move now to another challenge, which is organizations often don't fully analyze the potential cost benefit. And this is obviously very important. If we're going to invest operational resources and financial resources, what are we going to get out of it? And the CTA is going to introduce, during Connected Health Symposium in Boston, on the 25th, an ROI calculator. Now this tool will actually be enabled as an interactive web tool. So it'll be hopefully universally applicable. It's built around existing program results. So we think it has significant insight that will be hopefully helpful for all of you. So with that, I'm going to move control back to Val, and we'll go to some of the actual examples.
Thank you, Alan. We'd now like to turn to our two colleagues who've been involved on the front lines and implementing programs, and specifically contributing to the different tools that you're seeing here today. First presenter, we're pleased to have with us Jason Broad, the Director of Lean Six Sigma at Sharp. Jason.
So I'm going to give a little serve up of my project and then share with you how the toolkit has been helpful for us and I think maybe for other folks. Our project was to reduce 30-day readmissions for heart failure. We focused primarily on CHF and the underserved population, so unfunded Medi-Cal, Medicaid, and Medicare fee-for-service with unassigned PCP. Our intervention was primarily focused on using remote patient monitoring, where the patients would transmit their daily weights and their symptom yes-no questions through the technology. And then we coupled that with an education program where we had a health coach assigned to the patients, and this person would do 2 home visits, one to get them started on the program and then one at the end to graduate them from the program. And that was where the education was delivered, in addition to doing an intense medication reconciliation and addressing any of the other home social safety needs that we know often plague this population. You can see our results there on the right in terms of our success. We were able to touch 80 patients in about the 9 months we were active on the program, and this was our first go at it. And as we have continued with this type of program, we've seen our enrollments increase because we're more savvy with how to execute this kind of program and how to be efficient with our patient interactions. Overall, our readmit rate was down to 10% from a baseline of about 20% for the same population. And more specifically, if you look at the graduated patients' readmit rate, we had 65 patients who finished our program, and our readmit rate for that population was 7.8%. So definitely an indication that this program is working. And on the next slide, what I'd like to talk about are how the toolkit was beneficial for us. And 3 main points, the first being that having these tools facilitated a quick startup for our program. So the time from decision to launch the program to enrolling our first patient was actually very short, because we were leveraging the tools that were out there and then put our efforts on designing the intervention that would work for this specific population, rather than developing letters and forms and brochures. We were using stuff that was already out there. The second is, as we were launching this program and marketing it to our internal referral sources, physicians, case managers, nurses, ancillary department leaders, etc., we could show them that the materials that we were using came from vendors that had a proven track record with this technology, and then other organizations who also had success with similar programs. And so that gave us a little more support in terms of showing that this was a proven technology, proven system, a proven program, and that we were coming from the evidence of organizations that had results relative to patient satisfaction and patient care outcomes. And that dovetails into the final point, which is that using this toolkit and sharing the successes from which these tools come helped as a change management strategy. So the folks that we were talking to didn't think that we were sort of rolling the dice and starting something from scratch, that we actually were using tools that came from successful organizations and vendors, and that helped us get buy-in from folks that we needed their support on. So it didn't look so much like we were starting something new, doing brand new research, which in fact we're not doing. This is proven technology. These programs work, and showing the key stakeholders that we did our due diligence in terms of finding organizations that were successful and then reaching out to them to understand what tools they use and then incorporating them into our program, again, helped get support from the folks that we needed to have drive this initiative. And so from a change management strategy, I think that's probably the most beneficial part of using the toolkit, because we look like we're integrating into the world of remote patient monitoring and not trying to start something brand new. And one of the tools that helped us with our program in terms of being most successful is this Self-Care Heart Failure Index. This is a tool that's part of the toolkit and that we found useful in understanding patient activation. So this particular survey helps us survey and assess patients in terms of their level of activation and taking care of themselves before they enroll in the program. So this is one of the things that we did during our first home visit with the patient. And initially we thought this tool would be helpful for us in terms of assessing our results at the end of the program, and that's why we pursued it. But what we found, and I'm hoping that many of you that are doing heart failure will also see, that using this tool not only serves up a good result metric, but it also tells the key folks involved in the intervention, the nurses, the health coaches, et cetera, tells them more about their patients and helps them customize the program a little bit more to the patient's needs. This particular survey touches on a number of domains, and one of them being, their confidence in taking care of themselves. And we would recognize if they scored themselves really low in that domain, then we could tailor the education and the type of conversations we had with them to building confidence in taking care of themselves specifically, or if their issues were related to medications or something else, we could respond by tailoring the program. And so we recognized that it wasn't a one-size-fits-all, that even though we had a template of how we wanted to take care of the patient in a general care plan, we recognized that this tool helped us customize that a little bit. And you could see from the green line, which is the after program score, that our patients often, or in almost every case, scored themselves higher, and 98% of the patients scored themselves greater than the threshold, which indicates that they have the confidence and that they're activated to take care of themselves. So it not only told us the program worked, but also helped us customize the care intervention And this tool is available in the toolkit, and this is also something that's available in the public domain, so anyone's free to use it. Information is available on the CTA website, which will link you to how to find this tool and specifically how to use it. And that's our experience with the toolkit, and I'll take any questions at the end as we move into that portion.
Thank you again, Jason. And now we'd like to turn it over to Wendy Everett with another perspective on the development of the toolkit and its application. Wendy.
Thank you, David. And before I begin, I just want to acknowledge that Lisa Payne-Simon is also on the call as a participant. And Lisa and I partnered together on this project, but in truth, she did an enormous amount of the heavy lifting in creating the partnership with Atrius Health and in attaining a lot of the wonderful outcomes that we got. So as David said in his lovely introduction, NEHI is a National Health Policy Institute, and we have a very broad and deep interest in innovative telehealth care programs ranging from intense acute care environments and the use of tele-ICU to home monitoring in a more blended delivery system environment. Our project was quite different from Jason's in that we partnered with Atrius Health. Atrius is the largest integrated delivery system in Massachusetts, serves about 1 million patients across 50 sites. So it's a very complex organization that has a wonderful reputation here and is always interested in finding innovative and new ways to improve quality and to reduce the cost. So we were able to form a partnership with them. The advantage of that is that we had a terrific set of clinicians with whom we could work. We had a highly organized delivery system, and we had a patient population where we could demonstrate a difference. The second distinguishing characteristic of what we did was we put together a randomized control trial where we assigned congestive heart failure patients either to an intervention group or to a control group. We were looking at congestive heart failure patients as the model or the pilot project, hoping that if we got good results from the home telemonitoring intervention group, we could expand it to all of the different chronic illness categories that Valerie so nicely defined at the beginning of this session. We used the Philips Telestation as our technology, and our goals were very similar to Jason's goals, and that is clearly to reduce hospital admissions, to reduce emergency department and office visits, and to improve the patient experience of care. And I'll come back to that in a moment because it involves one of the tools in the toolkit. We were also interested in measuring the degree to which we'd been able to lower the total healthcare charges for the intervention group. So that was our hypothesis. Our results were from a very small population. Jason had 80 patients in his intervention group. We ended up with only 31. And there were several reasons for that small number of patients. One of them was kind of interesting, and that is that a lot of the seniors, when they realized that they might be assigned to the control group, said they didn't want to participate because they really wanted what they called the gizmo at home. So they opted out of any trial. So that's just a broad overview of what our project was. As we move to the next slide, our outcomes were really quite positive. We did get some statistically significant outcomes, but I think that Lisa and I would say that they, by and large, were directionally extremely positive, if not statistically significant. So we found that the patients who were assigned to the intervention group and using the home telemonitoring technology had fewer all-cause hospitalizations. They had about 1.5 fewer hospitalizations per year as compared to the control group. They also had fewer emergency department visits, fewer urgent care visits than the control group during our study period. Second, we found that the survey results from providing standardized surveys to patients, their caregivers, and their families showed some very promising trends in terms of the patients feeling a locus of control over their illness. So they felt they had better symptom control, the emotional burden of the illness on the family was less, and they were much more satisfied with what they were able to do on a daily basis. And finally, kind of one of our outcomes for both internal and external reasons is that the home telemonitoring system has now been completely integrated into Atrius Health as a routine practice. Now, there are also some externalities to that that I'll come back to. So as I want to parallel what Jason had to say about the benefits of the toolkit, I think that there are 3 major pieces that I would highlight, and I would really express great enthusiasm for this toolkit. We started our project before it existed, and we adopted many of the different streams and guides throughout the evolution of the toolkit, and I've just never used anything that was quite this magical. So I know that everyone is trying to be extremely objective today in presenting it, but I have to express my complete cheerleader enthusiasm for how it can be helpful. So first of all, one of the problems we had was a revolving door of champions. Now, this is partly one of the effects of working with a large, complex system, but going back to Alan's cartoon bubble slide, where we said make sure you have a champion for your project, we had champion after champion after champion. The physicians moved and took another job in Michigan. One of the project managers had a family emergency and had to leave. So I think the checklist in the ADOPT Toolkit really helped us understand the importance of having one consistent champion so that there would be a very smooth adoption of this innovation in a multi-specialty practice. Second, we had a very complex delivery system, and Val's work stream of actually making the case at the very beginning was an excellent communication tool. We did 13 chicken dinner road shows, and all of the clinicians and the department heads and the heads of the chronic care units heard the same message, and they understood how this technology was going to work. And finally, in terms of the conflicting roles and responsibilities, the starter kit and the guides can really help define the staff roles and responsibilities. In many instances, we had terrific consent and enthusiasm, but then no execution of the responsibility. And I think preparing for that at the front end would have been helpful. So I'll finish up with the last slide, which is one of the tools that we developed with David and Val's help was to create a set of patient vignettes. We got a fair amount of quantitative data and certainly good clinical data from our study, but we also had just a terrific number of stories. And I think that stories often help to activate an organization to move in a different direction. So at your leisure here, you can read this first vignette, but it talks about how a construction worker with SCHF really got very engaged in the project to the extent that he wouldn't eat dessert the night before his readings and his report to make sure that he really had a good report for the next morning. And at the point that our project was over, one of our patients refused to give the Philips telestation back. He's just locked his door and says he doesn't care if our study is completed, he's going to keep on going on his own. So those more personal and passionate vignettes, I think, have been very helpful. So let me stop there and again thank David and Val and Alan and Jason for helping Nehi to put all of this together, and also express my appreciation at being involved in this project.
Thank you very much, Wendy. We're now at time for question and answers. Unfortunately, we have just time for a few, but want to reassure individuals that we will take all questions and get back to you later. So please, even if we do not get to the question right now, please include it using the Q&A feature on your webinar page. Also, just like to mention that the next steps for the toolkit will be production and development of the mHealth toolkit later this year, and wanted to share with you that the Center for Technology and Aging is available to provide professional services and technical assistance in a number of areas, and you can contact us at this number. As we go into the question and answer, I'd also like to ask you to take the time to fill out the survey afterwards, and we'll be making sure that we are following up with any individuals on specific questions or interest areas. A first question that we had delves into the issues around the return on investment tool, with a question about how far does it share with the user what type of outcomes and who is getting the benefit of the resources of the program, and wanted to say that that has been developed so that it does both break out the savings to providers as well as payers over a 5-year period. So as that tool becomes available, which we will be announcing in the next week at the Center for or the Connected Health Summit in Boston, you will be able to see the various impacts that your program could have in terms of a return on investment, as well as being able to model different scenarios. Another question has come in basically asking, I'll combine two of them here, whether other users can submit tools to the website, and will we be adding additional tools to not only the RPM toolkit, but also the other 3 areas that we're focusing on. Val, could you please respond to that?
Sure. So right now, we're definitely interested in adding more tools to the toolkit site for all program areas. So feel free to send an email to support@techandaging.org and let us know if you have tools that you are interested in submitting, or just have feedback in general. But we consider all these toolkits to be living toolkits. They're not stagnant, and we're always looking to update them and make sure we have as many tools as needed for organizations to utilize.
Thank you. And another question regarding that we had mentioned that we can provide help with RPM-related efforts, and could we give an example of the types of assistance? Alan, could you please respond to that question?
Sure. So it's not a short answer, but I'll go quick. Any of the tools that you've seen or see on the ADOPT website, we can help administer. We can help develop your initial strategy, your program design. We can help with technology selection. We can do program management across the continuum of what you might be concerned with. We do operational workflow design, actual implementation work, so plenty of opportunities there.
Thank you, Alan. Well, I'm sensitive to the time. Want to make sure that the number of questions we had, many directed towards our colleagues who are in the field, that we will get back to you on that. Please submit any additional ones so that we can help in terms of either steering you to individuals or specifics about the toolkit. We will be following up with the additional components of the ADOPT Toolkit in the near future, and would encourage you to return to the Center for Technology and Aging's webpage on a regular basis to identify or see the new components of the toolkit as they are released. With that, I'd like to thank my colleagues for their presentations today, and thank you for attending, and we look forward to questions and comments from you, and we'll be in touch with our next update in the near future. Thank you, and goodbye.
Bye.